Hi, my name is Sawyer Matthews, and this is my rehabilitation project after lung resection surgery. This presentation provides an overview of the rehabilitation process following lung resection surgery. It summarizes what the surgery involves, why it is performed, and what the patients can expect during both short-term and long-term recovery. What is lung resection surgery? Lung resection is the surgical removal of diseased or damaged lung tissue. There are several levels of removal. A wedge resection, which removes a small wedge-shaped portion. A segmentectomy, which removes one or more segments of a lobe. A lobectomy, which removes an entire lobe and is common for lung cancer. And a pneumonectomy, which removes an entire lung when disease is widespread. The overall goal of these surgeries is to remove the non-functioning or harmful tissue while preserving as much healthy lung as possible. Why is lung resection surgery performed? The main cause is lung cancer, chronic infections that permanently damage lung tissues, benign tumors that cause symptoms, and damaged areas related to emphysema or bronchitis. Sorry, I can't say that. Removing the diseased portion of the lung often improves the overall function of the remaining tissue and can prevent further complications. Immediate recovery in the hospital is immediately after surgery. Patients are monitored closely in recovery or intensive care setting. Chest tubes are usually in place to drain fluid and air so the lung can re-expand. Pain control is a major priority using methods such as epidurals, nerve blocks, or medications. Managing pain effectively helps the patients breathe deeply and begin moving sooner, which supports healing. Common post-surgery symptoms are some normal post-surgery symptoms include shortness of breath, fatigue, chest and incision pain, mucus or coughing, and temporarily reduced lung capacity. These symptoms improve gradually as swelling decreases and the remaining lung adapts. Rehabilitation is designed to improve breathing efficiency, restore strength and mobility, prevent complications such as pneumonia or blood clots, and increase overall activity tolerance. It takes a whole-body approach and prepares patients to return to daily life. Some breathing exercises include diaphragmatic breathing to strengthen the diaphragm, incentive spirometer used to expand the lungs and prevent collapse, and pursed lip breathing to control airflow and reduce breathlessness. These exercises are essential to rebuilding the patient's lung capacity. Physical activity begins early, usually within the first day or two. Patients start by sitting up, standing, and taking short walks. Over time, these walks become longer and more frequent. Gentle stretching helps reduce stiffness after surgery. Heavy lifting or strenuous activity must be avoided for several weeks to protect healing tissues. For long-term rehabilitation, as recovery progresses, pulmonary rehabilitation helps build endurance and strength. Aerobic exercises such as walking or stationary cycling are introduced, followed by light strength training once cleared by a medical provider. Breathing retraining continues to support more efficient oxygen use during activity. Nutrition for healing. Nutrition plays an important role in recovery. High-protein foods support tissue repair, hydration keeps mucus thin, and anti-inflammatory foods like fruits, vegetables, and healthy fats support healing and reduce inflammation. Making sure you prioritize these foods is a key part of recovery. Some warning signs for patients are advised to watch for symptoms such as fever, worsening cough, sudden shortness of breath, uncontrolled pain, bleeding, or increased redness or drainage at the incision site. These signs may indicate that complications and these may be a sign that they require medical attention. For the recovery timeline, most recovery occurs in stages. The weeks 1 to 2 focus on rest and pain control. Weeks 3 to 6 involve increasing mobility and returning to light daily activity. Weeks 6 to 12 usually allow a gradual return to normal routines. Recovery time varies depending on what type of surgery and personal health factors the patient had. Thriving after the lungs resection. Many patients adapt well to changes in breathing capacity and return to active, fulfilling lives. Staying active, attending regular follow-up appointments, and maintaining good, healthy habits all contribute to their long-term success. And returning to exercise. The exercise progression includes 4 phases: gentle movement, endurance building, gradual return to jogging or light running, and eventually advanced fitness or strength training. The pace depends on the individual tolerance and medical approval. For week 1 to 4, I would begin with 5 to 10 minute short walks, the breathing practices, ankle pumps, and gentle arm circles. For weeks 5 to 12, I would increase walks to 15 to 30 minutes in low impact cardio like stationary cycling, introduce light resistance band exercises, and wall push-ups. And then months 3 plus, begin a walk-run program. 1 minute running, 2 minutes walking, light jogging, add body squats and planks. And then after month 6, you can progress to continuous running, hill training, varied terrain. And then you can also incorporate weight training and sport-specific movements. Recovery is possible, but you have to work hard and be consistent and do healthy movements for you. Thank you.